before to start to talk about the cerebral blood flow, I would like just to introduce what is. I am in fact, I am an old computer engineer. So when I start to work in this field, I have a lot of things to learn. Maybe you know that, but I think it's very important for the field to know that ICP, intracranial pressure, in fact, is very important for the brain because, like you can see, it's an important parameter in the brain pressure perfusion. Intracranial pressure. Intracranial pressure also is defined by the different volumes, the different compartments inside the cranial, the craniospinal system. And one of the compartments we have seen in previous presentation is the CSF, the cerebrospinal fluid. So, function of its volume inside the craniospinal system, it will define the mean intracranial pressure. And also, what is very interesting is that it's not only a static fluid in this system, but this fluid is moving up and down during the cardiac cycle. Why? Just because the arterial inflow, even if it is the mean value of the venous outflow, but during the cardiac cycle, it's not synchronized and exists an expansion of the brain tissue during the cardiac cycle. So I was very happy, I was very young, no. But to use a special technique, the SMRA, everybody knows the SMRA, to get this information, and it is only this technique that can take this information to measure, to quantify the CSF oscillation. So it's an amazing technique, SMRA, but in fact, this technique don't produce the good cardiac cycle. It's just a combination during the acquisition of many cardiac cycles that produce at the end the curves that we talk about during these 3 days. And this result is just the mean curve flow, but without standard deviation. So in 2015, I found in the literature a very new sequence. It was for me the solution of my problem because I want to get the real information of the movement of the fluid. And this sequence is, I call it the API SMRA, that can produce the image in one around function of the spatial resolution you want to get around in 100 milliseconds. We can get the information of the movement. And so the work I try to develop, it's just preliminary result of this work, is to see what's happened with this sequence and also to compare with my normal SMRA, the 2D SMRA. So I use this slice, a very well-known slice in the intracranial system through the carotids and through also the venous flow. Venous flow also is very important for me because it's function of ICP. So we can quantify this flow in these different arterial and sinuses. So this is an example of the two acquisition. We can see the different parameters, and what it is very interesting, it is that you can select if you want to have information for 5 seconds, for 30 seconds, or for 1 minute. And you can also adapt your spatial resolution to have an image every 100 milliseconds, for example. So from this new acquisition technique, we need a new post-processing. So we already have a little experience to develop our own post-processing to get from the normal PCMRI the different curve flow of the vessel. This is two examples of an internal carotid and a sinus. But now we have a new images, and we need to develop our new post-processing. So we have first to have a good segmentation algorithm. So we use, as we have done previously, the temporal information of the pixels, and we can see on the fast Fourier transform of each pixel inside the image. Some have a very interesting peak for cardiac frequency and also for respiratory. So we have all this information. So now we have the velocity, we have the area, so it's very easy to get the volume along time. Next step, because we have also recorded the bracing signal and the cardiac signal, it's very easy to segment each cardiac curve and reconstruct from each cardiac curve the curve from the inspiration period and also the curve for the expiration period. And easily, it is also possible to reconstruct the normal curve flow from all the cardiac cycle acquired in the volunteers. So we have the information. We can do it on the sinuses, like we have done in the arteries. And as you can see, we also point that exists an effect of the inspiration and of the expiration in these two examples. We have applied this approach in our 14 volunteers, and we found for each one that exists around 10% increase during inspiration and a decrease during expiration. So, also, we combine during one cardiac cycle the arterial inflow with the venous outflow to see if exists a change between expiration and expiration, but with this first result, it was not significantly different. This little curve, in fact, shows the volume, the blood volume change, that if we have access at the CSF oscillation, represent the expansion of the brain that push the CSF in the spinal canal. And when we compared our result, our mean result, with a normal traditional 2D PCMRI, we found, in fact, a very good correlation. But it was, I was surprised to see that the correlation was largely better from the sinuses than from the internal and basilar arteries. We maybe explain that because we have not exactly the same spatial resolution, so maybe I have to do something new again with the same spatial resolution. So in conclusion, we can say that exists a very significant impact of bracing in the arterial and also the venous flow, and that it's a very interesting new sequence, I think, because in fact we don't need any synchronization, cardiac or bracing or I don't know what, and we can assess the patient who have a very big change of their cardiac frequency during their acquisition, and we can also repeat easily the acquisition with different variants to have also the information of very small flow and not only the important flow. And maybe that open a a new way to understand intracranial, because I'm working in an intracranial system, new way to better understand some idiopathic pathologies that alter our patients. So thank you for your attention.